أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. يا أيها الناس إنا خلقناكم من ذكر وأنثى وجعلناكم شعوبا وقبائل لتعارفوا إن أكرمكم عند الله أتقاكم إن الله عليم خبير. صدق الله العلي العظيم.
Bismillahir Rahmanir Rahim. On behalf of His Highness Prince Aga Khan, Shia Imami Ismaili Council for Canada, the Canadian Council of Muslim Women, the Ismaili Centres, Vancouver and Toronto, in collaboration with the Muslim Awards for Excellence and the Institute of Islamic Studies at the University of Toronto, we welcome you to the inaugural Thought Leader Series celebrating Muslim excellence. I'm speaking to you from the traditional territories of the Coast Salish nations of the Musqueam, Tsleil-Waututh, and Squamish. And our speakers today are joining us from regions across this country that are the traditional territories of numerous Indigenous peoples. We recognize, honor, cherish, and are grateful to share this beautiful land with our Indigenous brothers and sisters. This series was conceived to showcase the contributions of Muslims to the Canadian fabric and to highlight the work of those individuals who are leaders in their fields of endeavor. Our faith teaches us to not only acquire knowledge, but to use this knowledge for the benefit of others. And so through this series, we hope to bring together Muslims of diverse backgrounds from coast to coast to coast, and fellow Canadians in the sharing of knowledge to build a stronger, more peaceful, and pluralistic society. The past 18 months have been extremely challenging for us as Canadians, and indeed for all societies around the world. Through the COVID-19 pandemic, we have clearly seen how connected all of us truly are, and that developments in one part of the world can quickly impact lives across frontiers. And throughout this challenging time, we have seen physicians and frontline workers exhibit compassion and commitment to their fellow human beings to keep us all safe and well. And thus, for our inaugural theme of this series, we have chosen Muslims in science and medicine. And our inaugural topic is navigating the currents of the COVID-19 pandemic. Today we will hear from three exceptional physicians who have been helping us here in Canada and globally throughout the pandemic. It is my pleasure now to introduce the moderator for today's discussion, Dr. Fariha Khan. Dr. Khan is a practicing physician in Bolton, Ontario. She obtained her Bachelor of Science degree at the University of Toronto, followed by her Doctor of Medicine degree at McMaster University. She completed her residency in Family and Community Medicine and a fellowship in low-risk obstetrics at the University of Toronto, and she has been in practice since 2006. Now, along with being a busy married mother of 4 young boys, she is deeply involved in voluntary community service work, which has taken her from urban Toronto to First Nations communities in Yellowknife to refugee camps in Bangladesh. She has had formal positions at organizations such as Nasiha Mental Health, Islamic Relief Canada, Conquer COVID-19, and the United Way of Peel Region. She is currently on the board of directors of the National Council of Canadian Muslims and the Islamic Medical Association of North America, and is also on the advisory council of the UNHCR Canada, leading the Islamic Philanthropy Subcommittee. Dr. Khan has been dedicated to addressing both the scientific and social determinants of health and wellness, especially for our most marginalized and vulnerable groups, through both her volunteer and professional commitments. It is now my pleasure to hand it over to Dr. Fariha Khan.
A big thank you to everyone who has joined us and is tuning in over Zoom. Hopefully we have the opportunity after this pandemic to have this kind of discussion in person, inshallah. So I am joined here today by two incredible individuals who are physicians, parents, and active community members. Abdu, who I've known for quite some time, and Fatima, who I've gotten to know only more recently. And I will say it is amazing to watch people who you've known for ages step into a place of such leadership and to watch them grow and develop in their area of expertise in this pandemic. And then it's also been amazing to meet new faces and new people like Fatima, who are doing such valuable and important work. And to me, these are the little things that have given me hope in this pandemic, that there are people who we know and people who we don't know who are doing such incredible work behind the scenes, you know, supporting their families and supporting their communities through this time of crisis. So I'm going to provide just brief intros of Fatima and Abdu, and we'll all be getting to know them much better as the call proceeds. So Dr. Fatima Kakar is a pediatric infectious disease specialist and clinical researcher at Saint-Justine University Health Center and associate professor of pediatrics at the University of Montreal. She trained in pediatric infectious disease at the University of Toronto and obtained her master's of public health at Harvard. Since 2011, she has worked as a clinician researcher in infectious diseases, providing expert guidance on perinatal infections to provincial, national, and international guideline committees. Through the course of the pandemic, Dr. Kakar has been a treating physician for both women and children affected by COVID-19 and has been leading epidemiological research on health outcomes among infants and children affected by the virus and on the immune system response to infection in children versus adults. Dr. Abdu Sharkawi is an infectious disease specialist with the University Health Network and an assistant professor of medicine at the University of Toronto. He has a keen interest in communicable diseases and providing public health education across multiple platforms to raise awareness and offer guidance for best practices. He has been a leading voice in Canada's medical community while fulfilling his role, particularly via a prominent media presence as CTV's lead infectious disease analyst and medical correspondent since the onset of the pandemic. So it's a pleasure to have both of you here today, and we are going to be talking about, yes, all things COVID as experts in the field, COVID in science, but more so we'll be having a conversation about your experiences, you know, in the world around you and within you over the last 16 months or so. As much as we think the world has changed, and it truly has, I think that as individuals, so much has changed within us as well. So I'm looking forward to hearing your insights on all of that. I'm curious, just to start off, maybe we'll start with you, Fatima, of kind of where you were, how your roles and responsibilities changed in this pandemic, you know, looking at the last 16 months or so.
Gosh, well, it's all a blur, to be perfectly honest, because these last 16 months have been sort of day in and day out COVID-19. But when you ask that question, so just to preface how unprepared we all were, and right before January and December at our last divisional infectious diseases meeting, we were practicing for Ebola. There had been a small Ebola outbreak in the Congo. And so as a team, we put on our Ebola suits, we were going through our Ebola protocols. And then when COVID hit January, February, we didn't take it seriously. We assumed it was going to be like H1N1. We make a big deal out of nothing. And really, it sort of trickled down to the point where early March, I was ready to go to Boston for the International HIV meeting. And it was really a few hours before our flight that they canceled everything. And suddenly, the infectious diseases community woke up and said, wait a minute, there's something serious. And then from that point on, it was COVID became the real issue. And in Montreal, as sort of Quebec was the initial hub, we missed the boat by about a month, where infections were circulating. We allowed March break to happen. And so by mid-March, we were in the thick of it. And we really had to start from point zero. So I remember early in March, we were actually looking through the Chinese protocols about how to set up COVID wards and how to set up isolation units. And truth be told, a lot of what we did followed what Wuhan did as far as isolation and separation. So very quickly, we had to set up COVID testing clinics and drive-through clinics. And now it's all sort of, it's been done, we know how to do it. But back in the day, this was completely novel. We had to find PPE, and suddenly we realized that we didn't have enough. We didn't even have enough hospital scrubs. So at some point, our hospital ended up getting prisoner scrubs, sort of those orange, because it was the only thing left on the market. So we had to scramble to create COVID wards, COVID protocols. And in the beginning, we had no idea what it was going to be. We thought maybe it's going to be severe in children, so we need to have multiple units and multiple preparations. So it was really the month of March and April was the beginning of the surge. And when we realized how bad it was hitting in Montreal itself, that's when the panic alarm set up. And very quickly, so I'm a clinician investigator. Before COVID, my area of expertise is HIV. And I do a lot of research in HIV. So by default, I also very quickly became involved in the clinical trials and a lot of the ClinEpi research and the surveillance data sets and the basically the monitoring of COVID in children. And what was really interesting and fascinating at the same time was having to provide the government bodies with real-time data. So just seeing what's happening on the ground and trying to feed that into these different committees to tell them, wait a minute, actually, the kids are fine. And so it was really interesting with the first hospital admissions. Everybody was panicked. You know, the first child with COVID was actually one of my patients who has another chronic condition. And it was pure panic. People didn't want to go into these rooms. It was sort of getting used to that. But after a while, we realized that kids actually do very, very well from COVID and aren't very sick. And so to take that and to explain that to people and to explain that to government agencies in real time as we're trying to create the data and as we're trying to put it all together. So that was really the first phase of the pandemic. But then I think that the hardest part of the first phase was how badly Montreal got hit in the old folks' homes. And so as an infectious diseases docs, we went on these SWAT teams. So we were taken from our pediatric hospitals and put into the adult hospitals and a lot of the long-term care facilities to do infection control. And I think that is what struck every single member of my division the hardest, was going into these centers and seeing the state of these centers and the state of the pandemic, because there were deaths on a daily basis. And this is where I think it's hard when we think back now to where we were a year ago, but we didn't have material, we didn't have stocks. We were really in that dire initial situation. And then from then on, it's just been a constant changing process. And I think the biggest thing is really for all of us to have been constantly adapting things like airborne transmission, lack of airborne transmission, how to treat, how not to treat. It's been a constant evolution of knowledge. And on any given day, we're asked to be the experts on this. So on every given day, you have to sort of come up with an idea and a solution based on what you know as best, which sometimes, and I'll be completely honest, we've been wrong. And a great example is I told everybody back in I think April, so I'm a perinatal expert. I told everybody there's no evidence of perinatal transmission. There is no congenital COVID. Don't you guys worry. Everything's going to be okay. A couple of months later, lo and behold, someone proves that there is congenital COVID. So I've learned that we have to be humble with this virus. We can't use any of our previous knowledge to predict how things are going to go. And really on a day-to-day basis, we have to adapt to it, because it hasn't behaved like anything we've ever seen in infectious disease before. It's taken us at a turn at every single juncture. And so I think we've really learned as an infectious diseases community to be humble in front of this virus, to not underestimate the virus, and really to quickly adapt. So I think that the biggest challenge has been adapting to it. And we can't use any of the same mechanisms, the same tools we've had, the same knowledge we've had as other things to deal with it.
So Abdu, I will turn it over to you because your experience in these in the early days of the pandemic and the transitioning of your role was very public. You were out there, and many of us were turning to you and looking to leadership, which is not a simple and easy thing on your end. So I'd love to hear your take on the experience of the last 16 months.
Well, you used the word humble, and Fatima used the word humble. And it's remarkable how often I have used that word, or at least thought about how important it is, because what happened between February and March of last year, 2020, was really a life-changing experience for myself as an infectious disease specialist. I had been through SARS, I had treated patients and colleagues and helped look after them. I'd worked in the slums of Nairobi, and I had scaled to the summit of Mount Kilimanjaro and survived septic shock myself. And I thought that there was nothing that I didn't understand when it came to the ravages of infectious diseases. And boy, how wrong was I, to the point where I really felt a lot of people were panicking unnecessarily. I would be the first one to admit that I was very wrong about estimating the actual degree of risk, the scale of risk, the severity of what was awaiting us. And what prompted my initial, I think, elevation into a much more public role was the fact that I sat down one day and I wrote a Facebook post because I was alarmed and disappointed about the level of panic that was percolating and spreading through the community, and what that was reflecting in terms of people's fear driving them towards self-interested behavior and losing their sense of perspective. And many of the principles that I tried to impart through that post still stand today. The one thing that I was certainly wrong about was the fact that the risk was very real. The way in which people were responding in terms of hoarding toilet paper and taking medical supplies from clinics certainly is not something that I would ever condone. But truly, the importance of being prepared, the importance of actually having the right amount of fear, not an uncontrollable amount of fear and panic, but the right amount of fear to motivate you to prepare properly, is certainly something that humbled me. And that Facebook post at some point, I think, was shared over 2 million times, completely overwhelmed me. I had no idea that that was going to be the case. And the next thing you know, I was getting calls from media outlets right and left and center around the world, and ended up being flown to Los Angeles to be on the Dr. Phil show. And very interestingly enough, in the span of a week or so, the knowledge really started pouring in as we started seeing cases, imported cases into Canada. And then we started seeing not just cases from Wuhan province, but in fact, cases from Iran, from astute physicians who just decided they were going to test for COVID-19 because of their instincts telling them that this was a syndrome and a picture that fit. And it became very clear to me very quickly that I had misunderstood, or at least grossly underestimated, what we were dealing with here, and that this was going to be something that was going to spread and was not going to be easy to deal with. And in a span of probably 2 weeks, we started to see cases multiplying throughout, people being hospitalized throughout parts of the bigger teaching hospitals and other major urgent care centers, et cetera, in the Greater Toronto area. And I started getting interview requests from the media, initially because of my Facebook notoriety, but thereafter because of my public engagement and my willingness to understand that this was something that was evolving very quickly. And I think it was a huge motivator for me to make sure, as a clinician and as an infectious disease specialist, I was very well armed with knowledge, that I was very current about what was going on. And also that I had a huge obligation and a huge responsibility to make sure that whatever advice or guidance that I was going to share was going to be credible, and that it was going to be something that was going to be palatable, understood, and enough to reach people with the right message. Because we were all gripped with a certain level of fear. We were all gripped with a certain level of uncertainty about what was to come. With a disease that we thought was just a strange and exotic phenomenon, that we thought would not be a problem, that would not cause real hardship. But it became abundantly clear people were going to die, and people were going to die in large numbers. And maybe the scale of this sort of devastation was something we needed to pay some very serious attention to. And we had to maybe change our practices in a fundamental way and reorient ourselves towards what we were going to do, how we were going to adjust in our lives, in our lifestyles, on every level imaginable. So it was, to say the very least, a whirlwind experience for me. Not unlike you, I was in Mexico in February with my family, enjoying buffets and pools. And being an infectious disease specialist, I'm hyper vigilant about hand hygiene. It's in my DNA, so that part didn't change. But we were also on a plane going back, and I remember seeing a family wearing masks in the seats in front of us and thinking to myself, where's this level of fear and paranoia coming from? It seems to be a bit over the top. And again, I go back to humility. It wasn't long before I recognized that they had the right approach, that in fact, it was simply normalizing and understanding what the proper response was. When the knowledge had accumulated and when credible sources started to really take part in making sure we were responding the right way we should, that's about pivoting and understanding that you do need to be humble. You do need to recognize when you're wrong, and it's okay to be wrong. And in fact, it's probably a good thing to be wrong to show that we are all human, and that the truth does not really lie within any one of us as human beings. It's not within a reputation or a certain station or level of stature that we achieve. It's about knowledge, and knowledge is sometimes elusive and sometimes it's very much approachable. But much as our Deen tells us, with the very first word revealed in the Quran, Iqra, we are commanded to read and to learn, largely because there is some level of ignorance within us that needs to be changed, that needs to be evolved and grown out of. And you can't have that without a sense of humility and recognizing that it's okay to be wrong and to look for others, to look for knowledge as it evolves, to seek it. And then when you have it and retain it, to share it responsibly. And that's pretty much how I took off from March of last year. But I could never have imagined I would have gone from relative obscurity to this sort of level of notoriety. But I'm grateful for it, and I'm humbled by the opportunity that Allah Subhanahu wa Taala has given me to find a path for reaching other people, and it's been a tremendous gift and a blessing for me first and foremost. I'm very, very grateful for that.
And to stay, alhamdulillah, for all of us and your loved ones to have stayed well and healthy through all of this is huge. And I'm equally grateful for the opportunity to have been doing the work that we've done over the last 16 months and to still be here. Hey, things change. New knowledge changes the way that we think and we act. And pivoting is okay, and it is a good thing. And we are people of knowledge as Muslims, and we value that. So I appreciate you sharing that story, because I think it's really important for people to see that it is not just okay, but it's important that we're able to shift our thought process. I found my role as a doctor really changed and expanded. In that, from my perspective, I'm sure each of you in your own way had a real mental health component with my patients as well. And having to sort of walk with them through these anxieties, through the unknown. So I'm wondering for both of you, how your role as a physician in your interactions with patients really changed moment to moment in the pandemic when you were interacting with patients and their families. Fatima, maybe I'll start with you.
So I think, the nice part about being a clinician is you see what's happening on the ground, and I can honestly say it's about 2 months ahead of what's going to be in the news and what the current reality is. Just as an example, by April, we were seeing all these kids. We didn't have infections, everybody was staying home, but we saw these kids with these crazy fevers that were going into septic shock in the ICU, and there were these clusters of kids with these rashes and fevers. And we were thinking something is off, and you talk together. And that was the beginning of this multi-system inflammatory syndrome in children, where suddenly we realized we have this new diagnosis that's happening post-COVID. And the first patients with COVID, the first children with COVID, were all children of long-term care facility workers. And I knew this because they were my patients. I was seeing them, and we asked the families who they are. And that, of course, pointed to us that the problem, weeks before it actually became evident that the problem of COVID in Quebec was in long-term care facilities, that these were the workers that were getting infected. So really for me, seeing my patients, it was basically a trigger as to what's actually happening in the real world and what's going to be happening weeks from now. So really being a clinician is almost like an insight into what we need to know later. And even now, for example, we see that viral infections are on the surge. I've been covering the wards for a few weeks, and I see tons of croup bronchiolitis, pneumonias, and we know that people are mingling. We know that that's a sign that deconfinement has happened. And so part of being a physician is actually really being on the lookout for all of these things happening as signals of what could be going on in the larger community, and actually quickly feeding that into the government and these different bodies. It was really unique in that for the first time, they didn't really need evidence, and they didn't really want, there was no evidence on COVID. So they quickly came to us as experts to say, well, what do you think? Should the schools stay open? Should they stay closed? What do you think? Should we do this or this? And within days, sometimes within hours, we had to, as physician experts, as pediatric experts, make these decisions. And so it was a unique position to be feeding directly into the government, and to be honest, to making these decisions up as we went along based on what we thought was best. So we said, sure, schools should stay open. They kept open the schools. But it was a bit daunting as well, because you're making judgments without having all the data and all the evidence.
I think up until now, we haven't, for those of us in general sort of community practice and even in academic settings, we as doctors day to day maybe didn't really have that opportunity or that role of transmitting our experience on the ground to decision makers, right? And that was something that was fairly new, and an additional kind of role that we took on. Everything down from like municipal leaders of what things looked like on the ground, even as parents, what it was like, what that experience was like. But transmitting that information upwards was kind of a new experience, and probably will likely stay moving forward. So Abdu, what about you? What would you say, sort of moment to moment, day to day in practice? How did you view yourself differently as a clinician, as a physician?
Well, we've used the words historic and unprecedented and unparalleled a lot in the last 16 months. And I don't think we can overuse them, because this has been such a bizarre and surreal and disquieting and disturbing experience for so many of us. And that is very much the case even for us as physicians. I think many of us as physicians view our work as not just trying to be vehicles for healing and health for our patients, but we want to advocate for them, and we want to promote a healthier community around them. And I think probably what I wanted to maybe highlight was just how much that became heightened and how much that was amplified through our individual experiences, because I think you really start to notice the systemic determinants of health. You really start noticing where there are some real inequities in our system, where the divide between advantaged and disadvantaged, resource and deprived, unprivileged, fringed, marginalized, there are a million different words you can use. But there are a huge number of people within our community who have been left behind for a very long period of time. And I think the sad reality is that it became very sobering to see that being manifested in a really tragic way. I don't know about many other physicians' experiences in different parts of Canada, but I imagine many of them are the same in terms of who's getting sick, whether you're talking about kids or you're talking about older adults or even middle-aged adults. Those that were disproportionately represented in hospital were Indigenous and people of color and essential workers and people living in low-income neighborhoods and people who generally don't have the best health literacy or access to healthcare resources. And that, I think, became a very painful reminder for us. that we had an obligation as physicians, not just to care for them, but to recognize that there was a real serious problem in terms of root causes for why they were the ones dying and why they were the ones overrepresented in our ERs and our ICU beds. And for some of us, it was an opportunity to, as you say, advocate. And it depends where you could do that, through grassroots efforts like Conquer COVID-19 or This Is Our Shot, or by doing things in a maybe less formal way, but not necessarily any less impactful in terms of just creating more of a communication sphere through any means. Of like-minded, critically minded individuals who want to promote better health education and want to promote volunteerism and care for marginalized members of our community. I think my role and the role of so many other physicians has changed because we have really felt this deep and profound sense of obligation to do something. And that's something that I think is a big part of what we're compelled to do. You know, as Muslims, we talk a lot about da'wah, trying to engage the message of our deen to others. And a lot of people take that literally in terms of the shahada and the very words of our beloved Prophet sallallahu alaihi wasallam. But to me, da'wah is an inspiration that we find when we go through any form of difficulty and hardship in our lives, and we can find a way to imbue any sense of charity or hope towards other people that reflects the best part of our deen. And that's something that was just such a incredible lesson for me. It was overwhelming at times, but it was beautiful because it really felt like I was being given an opportunity to do something rare, important, but incredibly unique. And I was really fortunate to learn from so many other people who were working so hard and so selflessly, and provided me with a great example to try and speak out for these people who didn't have a voice, to recognize that it's not okay. We needed to do something about long-term care and to respect our elderly and to give them the dignity that they deserved. There's verses in the Quran, that speak to the level of reverence and admiration and respect that we have for our parents, to the point that there's actually the word uff. When we say that we get angry or frustrated, it's mentioned in the Quran, وَلَا تَقُلْ لَهُمَا أُفٍّ, وَلَا تَنْهَرْهُمَا, which is do not be frustrated. The reverence that we needed to show for our elders is a huge lesson that I will carry with me, that we need to carry with me. The reverence and respect we need for essential workers who drive trucks and work in factories and make barely enough to get by from one paycheck to the next. This is a part of what we need to do. This is not just a part of our deen. This is a part of being a good citizen. And if nothing more, I found that learning to become an advocate was the biggest lesson and the greatest gift that I could find beyond just simply treating my patients from one day to the next.
Abdul, you mentioned, getting to know your patients better and paying attention to sort of those details of, the inner workings of their lives. And I'll share with you two patient stories. You mentioned families being, decimated. And I, in my practice, had a family where, gentleman in his 40s, a young family, young children, actually pre-COVID, played soccer with one of my boys. The husband, so the father in this family, had COVID. His elderly mother also COVID in the ICU downtown Toronto at the same time. Wife, pregnant with their third child at that time. She delivered by herself with her husband and her mother-in-law in the ICU. Her mother-in-law actually passed away with COVID with her son. I know it's kind of a messy map I'm creating here, on the same floor. And he couldn't be with her when his own mother died of COVID down the hall. And there he was, came home in oxygen to his baby that was already born in hospital. I mean, the layers and layers of struggle for a family like this. in the setting of COVID. You think about just the process of grieving, the process of loss, the fact that, as difficult as grief is, there is a mercy and blessing in that process when you have that, because it's what allows you to work through that aspect of life, death. Right. And families lost that opportunity. Postpartum depression, you worry about this on another level when the support system of what this woman had of her husband and her mother-in-law, living in a home with her elderly parent, no longer had that. So it's interesting because I live and work in Peel region, and the numbers, we were hit hard. And there was this sort of interesting, if you think of the layers of the xenophobia, the racism, all these conversations that came into play, and this almost laying the blame on certain regions in the country and in the province. And well, you look at where these folks work. You mentioned the essential workers, the frontline workers, but not the doctor frontline workers who have other means of protecting ourselves and other avenues of doing things. But I started to ask my patients and try to really understand, when they were frontline workers, what that really meant and what that looked like. And we underestimate the value and the role that these people contribute to society. One patient that really stood out for me was a woman in her 50s, and she had to go into the workplace. She worked in a factory. I would say probably by and large in the past, I maybe would have stopped my history there. I understand that they were sort of an assembly line factory worker, move on to the next topic of our visit, right? But I was curious to understand this patient a little bit better. I said, well, so what do you do? What factory do you work in right now that is essential? And this one stood out to me because it was a woman who worked, she said to me, I hand sew in a factory on an assembly line. And I said, oh, what do you hand sew? She hand sews parachutes. I thought, you hand sew parachutes, what for? She hand sews parachutes that are used by aid agencies and the UN to drop food parcels and essential supplies overseas off military planes and aid planes in developing countries and in countries in crisis and countries in need. And I thought to myself, this woman is doing the work of God, and she's the most unassuming, simple, racialized, woman living in Peel, who folks may have overlooked and thought, like, these are the folks that are perpetuating COVID and what's going on in that region. And I thought, well, who else was going to be doing this work? Like, not just locally essential, but globally essential work. And so I think that aspect of understanding the human story and what this experience has been like for folks, and what that experience is like to almost walk around feeling like you are responsible in some way. And the fact of the matter is that everyone's circumstances are just entirely different. And I don't think we appreciated that going into the pandemic. And I hope that going out of the pandemic, that's something that we really do pay a lot of a different kind of attention towards and a compassion towards.
I think what I really noticed is we have been told as physicians that there's a certain level of expectation for what the public wants us to do in terms of caring for our health needs. But when you start expanding your role and recognizing that you are very keenly aware of the root causes and you're seeing it repeatedly in front of you, there's an obligation there. And many of us may be uncomfortable following through on that obligation because you have to stick your neck out to a certain extent. And it sometimes becomes a political discourse, and people may not necessarily be aligned with the same set of values, because it's effectively telling people that the values we've been exercising in our society are not the right ones, that there's too much injustice and oppression and persecution and disregard for people in need. And that's an uncomfortable realization. And that's a difficult thing to digest, is to unearth our own warts and unearth our own deficiencies and say, we got to change this. There's a lot of good here. There's a lot of good in terms of what we have here in Canada, and we've got the raw material, but it's not being shared the right way. And it's certainly not being expressed in a way that is most deserving for everyone. Care involves really addressing the community around an individual patient, the family within that community, how it is that we're going to be able to help bridge those gaps, find those deficits. And I think many of us found our voice and are really hopeful, actually, that even though we've seen things that have been very difficult to admit in terms of the level of sadness and the level of tragedy it reflects when it comes to how far behind so many people have left, now we're getting a voice, we're getting a platform. Now there's a conversation happening. Now there's a bit more of awareness that says this is important. And you know what? It was important before the pandemic. And when the pandemic ends, it's still going to be important. And if there's another pandemic, these are the same sorts of people that are going to be afflicted. And we can't let that happen to the same scale. And it's a lot of work and it's not very forgiving. And I'm sure you know as well as I know, Fariha, that you don't always get the best sort of feedback from people who say mind your own business. What is it your right to start pontificating around that? And I think that we have to be brave. We have to remember that the reason we're in this position is it is an amana. It's a sense of obligation that Allah subhanahu wa ta'ala imbues upon us. We're not here by accident. We're here and we're finding these stories and we're seeing these things and experiencing these experiences. And Allah subhanahu wa ta'ala is giving us the hikmah, the wisdom to understand how to translate those experiences into ways in which we can find resources and find communication channels and find tangible ways in which we can change the world, the community around us, one person and one family at a time for the better. And that's just a wonderful blessing, as much as it is an incredible challenge.
And I think that, when you talk about it being a blessing, I think that through COVID too, we all sort of recognize that there were opportunities for leadership in so many different ways for so many different folks, right? People found ways to step up into their own spaces of leadership. So Fatima, your thoughts on leadership. What has leadership meant to you? What has your view of leadership of those around you been? Share a little bit of that with me.
It's been a real privilege to have a voice during this pandemic. And I don't take any interview and any media outlet or anything for granted because people are listening. And so I've really thought hard about the words that I use and how I use them and what I'm trying to convey in those quick segments and in those quick stories. Because one of the things that I think is so important that we didn't realize early on is how much stigma was associated with COVID and how it really alters the course of how people deal with the diagnosis. And I think especially in the Muslim community, it's something that really needs to be addressed. And I've hopefully tried to work with different groups to try and address this. Prior to COVID, I used to work primarily in HIV and in TB. And you can imagine that giving a Muslim family the diagnosis of HIV has been life-altering for them and is surrounded by so much stigma, so much shame, that it's really changed how HIV is managed, for example, in Muslim endemic countries. There was a recent outbreak in Pakistan where my colleagues on the ground were saying that it's really not accepting the diagnosis. And the reason is because people make associations with the disease. It's the same with TB. People with that diagnosis associate it with being poor, being underprivileged, and being in an unhygiene environment as they caught TB. And I will be honest to say that COVID was probably second only to HIV as far as the severity with which people took this diagnosis. I had people beg me to retest them 3, 4, 5 times because they were convinced they didn't have it. I had people beg me to erase COVID from their discharge diagnosis and from any paperwork so that this diagnosis didn't follow them, because they assumed that having COVID meant that you were poor, you came from an overcrowded, multi-generational household, and these were all quote unquote bad things. And so a lot of my job early on was to try to normalize having this disease, because it's something just like HIV, just like TB, that happens. We don't bring it on ourselves. It is nobody's fault. But this was one of the most difficult messages that I still have to get across to our marginalized and our patient populations. So being in a position of leadership and having a background that's unique and being from a different community it has helped me try to normalize these diagnoses within the Muslim community and within these populations. And I think that was one of the most striking things, is having to convey to people outside of this community what these diagnoses mean. For many people, COVID was just COVID. It wasn't a big deal. But when you come to it with a host of religious, political, geographic, a lot of different factors that interplayed with this diagnosis in your mind, it can make it really, really difficult. And so that was one of the most challenging things, but also one of the most important things, was trying to destigmatize COVID so that at least we could deal with it better within marginalized populations. And then just having a voice. So it's really been, it's been incredible to be able to have people who listen and who really act upon our recommendations and our thoughts. And truthfully, being a female of minority within these government committees is actually a very privileged place.
It's interesting how the conversation around leadership quite, naturally flows into how it is that we protect and look after our most vulnerable and our most marginalized. Where are we now? We're, as experts in this field, as parents, as community members and advocates and leaders, where do you suppose we are now? And where are we headed? What next? What do you think we need to be thinking differently? What do we need to be doing differently? Fatima, let me start with you, and then Abdul, I'll close with you.
So, I mean, the positive thing is, we've come out of this here in Canada for the large part, and, we're in that phase of celebration and things seem to be going back to normal. But I think we have to remember that we're really not out of this. And we're not out of this until the rest of the world is out of this. And I think one of the things we cannot forget is that COVID is happening all over the world, and this is a global infectious disease. And so we really have to use our now goodwill and our energy and our thoughts and our resources to contribute to COVID globally. And we've shown that we can do it locally. We know how to constrain, we know how to confine, we know how to mitigate the effects that we're having internally. But there are many countries around the world right now. There's food scarcity, there's closures, there's riots. The world is currently unstable as a result of COVID. And until every country has equitable access to vaccines, we're just going to continue to have wave after wave of COVID. So I'd really like us to shift mentalities now to say, listen, we've taken care of ourselves. We know as a country how to take care of ourselves, but we really want to make this a global effort. And so I think that's where we have to be now. We'll have subsequent waves of this pandemic. They'll likely be less severe than our current wave. But I really do think we always have to acknowledge that we don't know about COVID and things can surprise us. And so we have to be prepared for the unexpected. But we know how to mitigate things here in our settings. We've been through the worst of it and we've come out of the worst of it. So I'm not worried for us here in Canada. But I do worry that if we continue a narrow-minded approach where we're only looking out for ourselves, this is all going to come back to us year after year after year. So it's a real opportunity, I think, now to look beyond Canada and to look at what we can do as individuals, as clinicians, as health policymakers to help address this globally. Because I think that's what's going to continue on feeding these subsequent waves of the pandemic. So my hope is that we work together to make this a global response moving forward.
Absolutely. I think the global response, again, that's an entire conversation. And so, what is our role in leadership as Canada, even in terms of vaccination and the wellness of other countries that are underprivileged compared to us as Canadians here. So the global message is important. Abdu, the three of us are in Ontario. What about the cross Canada story? What are your thoughts on that in terms of next steps and what this looks like into the future?
Well, I think Fatima's words were just so eloquently put, and I want to pick up on that a little bit. And I want to draw a parallel to what we've experienced in the last 2 years as being historically unimaginable. The month of Ramadan and the lessons of the festival of sacrifice are about our responsibility towards each other. They're about the sacrifices that we make, the empathy that we drive from going through small samples of difficulty and recognizing the hardship that so many other people who are less fortunate go through perpetually, and being able to give of ourselves, sometimes through very, very small, almost tokenistic gestures, and sometimes through much grander gestures to make things better for other people. And that's the whole idea behind Think Global, Act Local. We've talked about leadership a lot, but I think people think about leadership as being formalized by being given a title, by being aligned with a certain affiliation, some sort of status within a recognizable body. But leadership is simply about putting your best form of humanity into action. It's about being a good ambassador of your faith, of values, of goodness and decency. And we are blessed as Muslims to have such great values and principles that guide us through our lives in so many different ways. So when you talk about what's happening across Canada, it means it's important. We may be getting through this in many parts of the bigger urban centers, but there are many parts of Canada, including parts of Western Canada, that are going to have difficult times. There are already cases being identified in certain communities that are not being targeted very well. There's a lot of vaccine hesitancy in many remote communities in different parts of Canada. And that's an issue that needs to be addressed. And as Fatima mentioned, this is a global pandemic. We have to remember that as travel opens up, we know that there's a wide cultural diaspora of Canadians with families that stretch throughout the Indian subcontinent, parts of Southeast Asia, and many other parts of the world that are actually still really being ravaged by COVID. We're seeing some tremendous losses in parts of South America and still parts of Southeast Asia. And it's largely because of vaccine inequity and vaccine inaccessibility. So to Fatima's words earlier, we've got to do everything we can to open up this conversation towards vaccine education, towards ensuring that we advocate for equitable distribution of vaccines to other parts of the world, because this problem or this disease or this pandemic didn't just grow out of Peel region or out of the greater Vancouver area or Edmonton or Halifax. It came from Wuhan province in China, and then all of a sudden it was in every corner of the globe. And that sort of situation can certainly recur if we don't follow the principles of accountability, of responsibility that we have to others. And in every stage of the pandemic, we've seen that. Our responsibility to put on a mask before we go into a setting where there may be others who are going to be vulnerable. Our responsibility to make sure we're not even physically in the same place as someone else who may be more vulnerable. Now, our responsibility is to get vaccinated, not just to protect ourselves, but to protect everyone else. And going beyond that, to advocate for any way in which we can have vaccines distributed to other parts of the world. And the irony is, if we don't do that well, we will be ending up undermining our own interest in some measure, whether it's small or large. And that doesn't make sense on any level at all.
So vaccination is a conversation that has been at the forefront for the past several months and will continue to be. From a faith perspective, I was reminded that, at the end of the day, we put our trust in Allah. And you almost, as Muslims, look at this vaccine as a vehicle of His rahmah, of His mercy, of His guidance, of His protection for you. And so holding on to faith at the end of it all, for me, is what has carried me through. And for me is actually something that I share as my perspective and what has carried me through, whether my patients are Muslim or not. I don't think I necessarily spoke with patients about my own fears or what I turned to. And when I did that, you see their shoulders come down. And, all this talk about what the future looks like, global, local, border to border, it's been an overwhelming year. And it's a bit of an overwhelming future when you think about it too. But for me, the things that I've sort of pared down for myself and that I hold close are just a couple of quick thoughts. I think often about the hadith that talks about, even if the hour is upon you and you have a seedling in your hand, plant it, right? And it's that reminder of, as big and overwhelming as things may seem, if there's an opportunity to do good, to do something small that's headed in the right direction, even if you don't know the long-term outcome, do it. And there's something about that maintains our hope and maintains our resilience. And for me also, with all of the things you could do, not do, like the changing information moment to moment, trying to manage a big practice, trying to manage working in the hospital and managing your kids and managing, aging parents and, online school, all these things, you can't do it all. And I have, as one of my sort of self-care pieces that I've hung on to, sure, there's a self-care of exercise and getting fresh air, and those are all very important valued. But for me, it's been the reminder that in Islam, the best of deeds are those that are done consistently. Even if they're small, they're consistent and they add up. I'm hoping that you folks might have something to share with those of us that are joining today and with me about what it is that you hold on to, however small or simple it may be, faith-based or not, but that carries you through. Fatima, let's start with you.
Sure. I mean, I think the biggest thing is what I realized at this pandemic is that people are fundamentally good and some people are extraordinary. And I think being in healthcare, it's been such a privilege to see people rise to the occasion, put their lives on the line, and be courageous in their day-to-day moments. And I think for me, the first moment and the one that really cinched it is my first week on the COVID ward, where it was brand new and we're all settling in. And essentially, once you're in the COVID unit, all you have are scrubs and PPE. There is no labels, there's no name tags. So, and you don't really want to leave because you don't want to contaminate the rest of the hospital. So we would spend lots of time just sitting around on that unit. And so it was me, my nurses, the cleaners, the orderlies, and people had really volunteered to be there. And at some point you're looking around and we all look exactly the same. There's no hierarchy, there is no order. And you just think these are courageous people who have volunteered to be there just because they believed in it. And that was my first moment when I realized that, even on this level, we are all equal. We are all exactly equal physically, appearance-wise. And there are such courageous people that stepped up to the occasion to volunteer because they believed in the cause. There are COVID taxi drivers who would take our patients home, the security guards that literally volunteered and signed up to do this and signed up to screen people. And I can list countless stories after stories of going into these small towns with these outbreaks and seeing ordinary citizens and cooks and cleaners and people just really stepping it up because they wanted to help. And I think that's been the most inspiring thing for me, in spite of all of the media and all of the issues around vaccine and not vaccine and the politics of COVID and all of the bad that we're constantly hearing about. I think the biggest privilege in being in medicine is seeing the good and really these COVID heroes and these people that have really stepped up. So I think that's what I'm taking with me from this pandemic. It's really highlighted the best of people in these most difficult times.
Faith in the goodness of people. That's wonderful, beautiful. Abdu, last words from you, Dr. Sharkowi.
I think that this pandemic has really been a microcosm of the most difficult challenges that many of us could have ever imagined. I think when you recognize the duration, the intensity, the breadth, the scale, the interconnectedness of so much loss on so many different levels and in so many different arenas, it's just such a valuable learning experience. It's a painful one. Some that are not so privileged to have gone through unscathed. And I think that when you take a breath and you step outside of it for a moment, you start to reflect on some of these incredibly profound and very moving experiences that we've shared with some of our patients and some of the really admirable acts of kindness and charity that you've seen from courageous volunteers and people who have done incredibly generous work and stellar work that is not often recognized. It's not publicized. It's not notarized in any way, but it's there. You really recognize the simple truths of what it takes to be a good citizen of humanity, what it means to be a good ambassador of faith, what it means to be a good ambassador of your community. And that's the simple act of kindness and compassion, of charity and humility. These tenets are so deeply embedded in Islam, in our religion. They are formalized and they are informalized in terms of the values that our prophet, our beloved prophet sallallahu alaihi wasallam, lived when garbage was heaped on his back, and yet he turned and responded with kindness. When insults were hurled at him and slander was directed towards him, he didn't turn back with anger and frustration and equal vitriol. We've seen so many opportunities as healthcare providers and as leaders and as advocates where we've had people with opposing views and who have resisted our attempts to try and further an agenda that we think is for the collective welfare and bettering of our society around us. We have to remember these lessons. We have to remember the example of our beloved prophet, and to take the simple lesson of knowing that the best way to be is to try and humble ourselves, is to try and build bridges between one another, whether we're talking about Muslim or non-Muslim, whether you're talking about in your own community or outside your community, in your own country or in another country and another part of the world. If we practice that philosophy and practice that set of values, we're going to come out of this pandemic, this experience of incredible loss, and tragedy of unbelievable scale, and we're going to move towards maybe a future where our children, subhanAllah, will have seen an example that may not be repeated, maybe in their lifetimes, maybe it will. And if it is, they're going to be in a position where they can be leaders, where they can be proud ambassadors of our faith, and where they can build bridges and do things that best symbolize what it means to be a good Muslim, to be a good member of our community, and somebody who can help by doing a simple act that may reflect in a better life experience for someone they may never meet. And what a better gift than that? There is none.
Abdu, you said that word again that came up right from the beginning of being humbled. And I think that that really, this entire experience that we're still in, that we're not out of yet, it is quite a humbling experience and a reminder to all of us that, like, we are so small in this big, big, big world, but we all have this collective responsibility. I hope and pray that inshallah we have these conversations and even better conversations in person one day. But we will wrap up. And I'd like to thank the CCMW again for putting this event together alongside some very special partners, the Ismaili Centres from Vancouver and Toronto, and the Muslim Awards of Excellence, MAX, and as well the Institute of Islamic Studies at the University of Toronto. Thank you so much to both of you who I know are so busy for taking the time for this conversation. And inshallah, I look forward to us connecting once again.
Wow. Thank you, Drs. Farhia Khan, Abdu Sharqawi, and Fatma Kakar. That was an incredibly engaging conversation about such a complicated topic that the world is still grappling with and will be for some time to come. COVID-19 has changed everything for everyone, but it's evident from your discussion that for the three of you, the change has been transformative and has been full of life lessons that will help you continue to heal your patients, your communities, and also strengthen your faith. You covered the challenges you faced professionally and personally while dealing with the pandemic with changing reactions and responses on a minute-by-minute basis. Your concerns about the disparities that exist in our local communities and around the world between the haves and have-nots show your humanity. What I found particularly inspiring was your dedication to your work against all odds and your determination to keep going to fulfill your Hippocratic oath. We've been impressed with your advice and knowledge on TV appearances and in the community. In today's discussion, you also shared with us the role that our faith plays in your lives and what it means to serve others in the Muslim tradition. In this series, we wanted to shine a light on Muslims who excel in their work and make meaningful contributions to Canadian society. Our panelists today serve that purpose beautifully. On behalf of the Ismaili Council of Canada and the Ismaili Councils of Vancouver and Toronto, the Canadian Council of Muslim Women, the Muslim Awards of Excellence, and the Institute of Islamic Studies at the University of Toronto, we would like to thank Dr. Khan, Dr. Sharqawi, and Dr. Kakar for giving us their time and sharing their insights while navigating the turbulent currents of COVID-19. I would also like to thank Dr. Aman Haji and our team at the Ismaili Councils and CCMW for making this event possible. If you enjoyed our inaugural program, please tune in next time for Muslim thought leaders in the field of climate science and planetary health. Thank you for watching.